Hi, good evening from a very rainy day in New York City. I'm David Levine. I'm co-chair of Science Writers in New York. My other co-chair, Joe Bonner, is behind the scenes, who's taping this for YouTube and also putting it on our website. My guest tonight is Avital Havusha. She's Vice President for Programming at the New York State Health Foundation. Prior to that, she was Managing Director of Performance Improvement at the Primary Care Development Corporation and Deputy Director, Public Health Solutions and Policy Director for the New York City Department of Health and Mental Hygiene. She has a Master's of Public Health from Yale University and a Bachelor of Arts from Washington University in St. Louis. Avital, do you want to join us?
Great. Hi, everyone. Good to see you.
Hi. So Avital has a slideshow to show us, so I'm going to let you share your screen and
Great.
Go ahead.
I'm going to go ahead and share my screen, and hopefully everyone will be able to bear with me for one moment.
Okay.
And there we go. Great. So I'm just going to back up here. Great. Well, it's good to be here with all of you this evening, and I'm excited to share more information about some research and programmatic work we've been doing at the New York State Health Foundation on the issue of food scarcity. I think this has been an issue on the forefront of many of our minds, on, as all of you have seen on the cover of the newspapers and, TV, and even in our neighborhoods where we've seen long lines for food pantries and soup kitchens. And folks waiting for food to be delivered to their doors. And so I think it's a really important issue, especially as we look towards hopefully what will be some sort of recovery from the pandemic in the coming year and months. And so great to be here. Just a little bit of background on the New York State Health Foundation. We're a private independent foundation, and we do grant making in several areas. Covering a whole range of health issues, really with a mission to improve the health of all New Yorkers, especially the most vulnerable. And one of our biggest issues is the connection between health and food. And we've done a fair amount of work in that area to help make sure that people have access to the healthy food and affordable food that they need to thrive. And in addition to making grants as a foundation, we really see ourselves as an advocate and a change maker. And so we do a lot of research to really push the needle and inform what's happening on the ground and from a policy perspective at the state and local level. So in that vein, as the pandemic has persisted, one of the areas we've really been digging in is on the issue of food insecurity and food scarcity, really trying to understand people's needs when it comes to food and their access to food and how it's affecting their health. And so one of the ways we did that is through a recent report that I think many of you have seen in the announcement for this event tonight. So I just wanted to walk through a little bit of the context to set the stage. I've got some graphs. I won't linger on them too long, but just to give us a sense of what we found. So as a starting point, just wanted to note where we got the data from. So at the start of the pandemic, as I mentioned, obviously we were all seeing kind of what was happening in our communities across the state in terms of people's experience with the pandemic, whether that was mental health, their mental health needs, their access to healthcare needs, their perceptions of stay-at-home orders, and very top of mind, their access to food. And the federal government actually responded quite quickly to try to understand those needs in real time. And the census launched what they called the Pulse Survey. And the Pulse Survey really was a way to essentially take the pulse of what was happening on the ground starting in May, ask questions of households and adults about a whole range of things, food being one of them, mental health being another, to understand how the government and states needed to respond. And so we were able to access that data to pull out some of the lessons and some of the findings for New York. But I would just note that there's this data is accessible via a tool that I have a link here. Might be interesting for a lot of you to take a look. It really allows you to dig in, and they have some visualization tools about what's happening across different states. But I'm going to give you a bit of a sense of what we started to learn when we took one step further to do some analysis of this data. And so the main measure here is something that they call food scarcity, which really is kind of people's access to and to food. So really it's the idea of quantity of food. It doesn't measure necessarily the healthfulness of the food or the quality, but it's all about, did you have access to food that you needed to not be hungry? And so I just note that caveat because obviously we know that the quality of the food is pretty essential as well. So I'll jump right in. So I have some of these kind of interactive slides here so we can take a look at some of the data. But just, sorry about that. Just wanted to start by just giving you a sense of kind of overall what was happening in New York since May. So I think one of the first things that we all think about with issues of food insecurity and food scarcity in particular is, how does this look different than what was the case before the pandemic? We know a little bit about that. I would say that there's different measures of this issue around food scarcity, so we can't necessarily compare all of them. But we definitely can compare this measure from the beginning of the pandemic here, kind of in May, into the winter time period where we have data till. And so as you can see, steadily kind of either steady state or really increasing by this period in December, when 14.3% of New Yorkers were reporting that they often didn't have enough to eat, either often or sometimes didn't have enough to eat. And, just in terms of giving you a sense of what this pre-pandemic and post now in the pandemic food scarcity rates look like, we know from other measures that have been being tracked by our partners and by other researchers. For example, as some context, here in New York City, there was, at the beginning of the pandemic, about 1.2 million New Yorkers who reported being food insecure. And by summer, that number had gone up to at least 2 million. And so we're really just seeing that kind of stark increase. And it's really mirrored here by this data that we saw over the course of the pandemic, where in December, we're still steady state at this 14.3 New Yorkers. And I would really point out most starkly what, is you're going to start to see this in my presentation throughout, is these persistent and really troubling disparities in terms of race and ethnicity. So when you look at that data about who sometimes or often didn't have enough to eat, you can see here the difference in Hispanic and Black adults reporting, one in 5 Hispanic adults and households reporting that they didn't have enough to eat. And among Black households, that was 1 in 3. And that was 2 to 3 times higher than it was for white New Yorkers. So really these, troubling disparities, these types of disparities were the case before the pandemic, and they've played out throughout. And so it's important for us to really think about that as we're talking about solutions, which I'll tell you a little bit more after some of this data. I would also probably some of you are wondering, what's New York look like as compared to some of the rest of the country? So New York kind of tracked, this black line here is the rest of the US. So New York has generally tracked along the same lines as the federal or the US average. I'm sorry, I apologize. The red line is the U.S. We've tracked closely to the U.S., but just in these past few months in the winter, New York has kind of crept up. And as you can see, all these other colorful lines behind the New York's black line are our neighboring states. So New York has consistently throughout the pandemic really been showing higher levels of food scarcity than some of our neighboring states. This data is available, this particular overall rate is available on the US Census Bureau's website. If anyone's interested in kind of taking a look what other states look like, but New York has consistently remained above some of the other states, unfortunately. And then one of the measures I want to just highlight here is food scarcity among children. And the reason why this is such an important point that we talk about a lot is that these are households that reported that not only were the adults in the household not having enough to eat, or sometimes not having enough to eat, but children were as well. So adults were reporting that kids in their homes also didn't have enough to eat. And the reason why that's particularly troubling is because we know that oftentimes adults will potentially forego a meal for themselves in order for their children to have something to eat. And so once you start to see these rates increasing among children, it's really indicative of a stark and severe problem and pretty troubling. And so just wanted to note that. And of course, unfortunately, as I said before, these disparities among racial and ethnic groups are persisting. So you see this very similar to the overall rates, but even kind of more stark among Hispanic and Black households. You're seeing those rates among children at 3 to 4 times higher than among white children. So then I'll skip us over to kind of one of the big questions that I think probably a lot of people have is, this question of the connection between food scarcity and not having enough to eat and income, obviously, and employment, of course. Obviously, we know that there's food insecurity is often the result of, it's a downstream factor of high rates of poverty. And obviously, people's loss of income is going to affect that. And so one of the cool things about this census survey is that in addition to tracking at the same time this question of did you have enough to eat, it was also tracking things about people's loss of employment. So we could start to see some of those correlations, which you'd expect, not surprisingly, between people's higher food insecurity rates and their loss of income. So the thing I just wanted to point out on this graph here is you can see that when there's a person who's lost their household income, they're reporting much higher rates of food scarcity and not having enough to eat than those who did not lose their household income. So it's not necessarily surprising, but what it's showing us is that in those households where there was a loss of income and employment, there's 4 times higher rates of food insecurity and scarcity. And again, kind of the same theme that we're seeing throughout is these troubling disparities across the board. And so this is showing us here on the right side of the screen is really, if you break this down by race and ethnicity, you're seeing among adults in Black households, that rate is 9 times higher. That food scarcity rate is 9 times higher for those who have lost their employment income than those who haven't. So it's really, starting to see how this is playing out for people in terms of shifting circumstances around their employment, persistent unemployment over the course of the pandemic, and how that's just, really kind of creating a situation where in some cases, the food and scarcity rates might be remaining steady, but also just really seeing those increase over the fall and winter period. And then I would want to shift a little bit to this question of, okay, so when we have this situation where people are in a situation where they don't have access to the food that they need, where are they turning to? We'll talk a little bit more during the conversation about some of the truly massive and Herculean efforts that have happened at the state and local levels around emergency food and getting people the food that they need. And some of that's playing out in what we're hearing from people on the ground about where they're getting their free meals and groceries. So you can see on this slide here that we're seeing a consistent rate of families reporting that they're getting free meals and groceries in the past 7 days. So kind of consistently, 10% or more of New Yorkers are saying that they were getting free meals and groceries. And as I have shown in previous slides, you're seeing that rate much higher among Black and Hispanic households, where they're reporting higher rates of accessing, closer to 20% of those households reporting that they were accessing free meals and groceries. And then the question is, a lot of this is, where are they getting that food from? Where are the free meals and groceries coming from? Where are those free meals being delivered to people? And I won't go through everything on the slide on the right around free access points, but one of the things that we saw over the pandemic period were a huge number of emergency food program sites mobilizing. We also, unfortunately, did see some food pantries closing. They had often, if they didn't have kind of strong infrastructure to begin with at the start of the pandemic, they really couldn't continue operating. There were some reports, I think, in New York City towards the summer that close to 25 or 30% of food pantries had closed. But then what you did see is this green line here is a huge rate of people accessing those free access points at schools. Some of the dip that you probably see here in the summer months were that people were less connected to their schools. The schools are offering kind of free, what we call free grab and go meals, where anyone, no questions asked, can go and pick up meals for their kids and also for the adults in the family. And so the reason why we think that, the spring was when those grab and go meals and were really getting ramped up. There was some fall off in the summer, and then as the fall and winter started up, people started accessing their meals at the schools again. And then, a whole range of other places. Obviously, we've seen a lot of home delivery happening where there's, and oftentimes local networks getting food to people's doorsteps, or kind of community-based organizations and local government agencies. The city of New York has mobilized a lot of efforts, and then everything in between, whether that's friends and family, food pantries, as I mentioned, or religious institutions. And then there we go. So the final slide. So this is an interesting point that I would kind of add to the mix of this kind of constellation of issues that's happening. One of the things that the Census Pulse survey added towards the fall and winter period, this wasn't a question that was on at the beginning of the survey. So they started asking this question about where people are spending their dollars from, like where are their sources of income and where is that coming from? They asked that question just in this November, December period. But what we were able to do is we were kind of able to correlate how people were reporting, what dollars they were using to meet any of their spending needs, not just for food, but just generally, where were they getting their dollars for their family's spending needs. And we were able to kind of match that with what was happening around food scarcity. So what I'd point out here that's, really kind of stark again, is this idea that among families that reported that they were food scarce, so those families that reported that they might not have enough food, 50% of them were reporting that they were borrowing from family and friends for their regular household needs in terms of dollars. Close to 45% reporting that they were using credit cards, and then many really dipping into some of their savings or selling off some of their assets. And so, as we know, as opposed to what we have here, like regular income sources, potentially that being some benefits or a regular source of income through employment, you're really seeing this kind of dip here around people that were food scarce, only 30% of them relying on that for their source of spending. And so, of course, these ideas of borrowing from friends, credit cards and loans, selling assets, those aren't sustainable sources of income. And especially for families who might be in a situation where in the past 7 days, they were reporting that they didn't have enough to eat. It really creates a very precarious moment when we know how people's spending patterns are affecting their access to food. And so we'll continue to kind of track this as a measure moving forward. And I think the other thing to say is that the Census Bureau has continued to be able to field the survey nationwide on a biweekly basis. And so at the New York State Health Foundation, we'll be continuing to kind of track and see how things are panning out as we enter into this kind of potentially new phase as people start to get vaccinated. But we expect that there'll be continued needs around people's access to food and healthy foods in particular, even as we start to shift into potentially a period where people are able to be at home less, be out more, potentially securing employment again. There's, a long road ahead. So I'm excited to talk through a little bit about, more about some of what's happened at the state, city level around solutions, but wanted to ground us in the data to get started. So I'm going to stop sharing my screen now.
Hey, so welcome back.
Thanks.
So how is the rest of the country doing compared to New York?
I think, as you could see in some of our analysis, New York, not faring so well in terms of our neighboring states, on par, like overall, in terms of these food scarcity rates with some of the national averages, but we're dipping ahead. I would say there's definitely, pockets across the state, and especially in larger states, where we're seeing really similar trends. I think when you look at especially kind of the anecdotal news reports, et cetera, coming out of states across the country, it's a lot of the same story of people, emergency food programs, food banks being really kind of overwhelmed. New York in particular, despite our high rates, as you saw, we also have a pretty massive infrastructure when it comes to emergency food, and kind of being able to mobilize a lot of assets. So we did that over the course of the pandemic. And I would say a lot of people, I think, would say that because of those massive efforts, both here in New York and other states, we staved off what could have been like even more of a crisis. We're still in, this is I would say, a crisis in terms of food insecurity. But I think some of those efforts around emergency food, around getting people some of the food benefits they need from like food stamps and other things like that, really staved off more of a major crisis. And New York really did, New York City and New York State, and we can talk more about some of what we did, mobilize quickly in a massive sort of way. But we also are starting to see a lot of those inequities, like I said, be just exacerbated. They were there before the pandemic. I think some of those disparities in New York are potentially more pronounced than in some other places. And they have either worsened or very much played out in the same way during the pandemic. And it's really problematic. And I think across the country, you also have pockets and regions where, some of those disparities might get masked by like a statewide rate. If you really dig into a regional or a local rate, you really might see these stark disparities.
Okay, so for the people who are listening in, if you have a question, please put them in the Q&A box and we'll get to them. Thank you. So Avital, so obviously Hispanic, New York City has a large Hispanic and Black population, but in rural areas in upstate New York, are we seeing a lot of food insecurity there too?
We are. What's interesting is, there's like different reasons and potentially different routes. So I would say before the pandemic, if you looked at kind of the heat map of food insecurity rates, you saw real pockets in the North Country, in some areas in Western New York, in the Southern Tier, and so certainly those rates are potentially more driven by transportation issues, potentially reduced access points, also some issues related to employment and income. I kind of highlighted a lot of the racial and ethnic disparities in my slides, but you see a lot of those same disparities playing out around income. And so in the rural areas, some of those disparities might be more tied to income. But we are, and some different solutions. We've, at the New York State Health Foundation, for example, a lot of some of the grant making we've done over this period in the rural areas has really been trying to leverage some of the local farms and connecting those local farms to communities to make sure that the healthy foods from those farms are getting into the hands of families in rural areas.
Okay. Someone just put a question in the chat box. Please put it in the Q&A box. Has there been work to connect community-supported agriculture to grants so they can supply food to food insecure households?
It's a great question. And yes, I would say some of them might not be like your typical, it might not be CSA in the exact sense of a CSA, but there's definitely been, yes, that is what's happened. And then there's also been some new programs, like, for example, we've done some work in Rochester and also in the North Country around building these, what they're calling healthy food boxes, which essentially is a kind of CSA type of box, where the food banks are partnering with local farmers and with local community-based organizations to build out these boxes of healthy foods, including farm-grown healthy vegetables and fruits and other kind of healthy shelf stable items as well. And what's been really interesting is by leveraging some of what's happened at the federal level, there's been new ways to use some of the, let's say, your food stamps dollars. And we have these in New York, lots of these things called nutrition incentive dollars, which essentially, like, let's say you spent $10 in your food stamps, you might get 10 more dollars in one of these incentives to spend on healthy foods. And people have been really creative about creating reduced cost fresh food boxes or CSA boxes to get to communities. And they're now creating sustainable ways of really getting those prices down to like 70% on the retail value of one of those boxes so families can afford them. So some really cool, innovative ways that, you know, as we sometimes say, you know, necessity being the mother of invention, but there's been some definitely some creative ways to get those healthy foods into people's hands.
So I was talking about COVID in particular.
Sure.
I understand that, you know, people have lost jobs. You know, some people are getting unemployment, some people couldn't. I understand. So that means income is going down.
Mm-hmm.
But also, I guess my real question for you is that was part of the problem that there were less people able to handle, less like New York State employees or people running or volunteers or there are just less people to actually do these programs that were existing.
In terms of getting food to people?
Yeah, because of COVID, and
Yeah.
especially in last March of March and April 2020.
I think some of it might have been that, although I do think that there was actually, there's a few things that were going on, I think, at that period. One, you had this, and we didn't talk as much about this, but obviously this connection between health and food. And so a lot of the frontline service workers were also people that were most at risk for COVID, which was problematic in terms of this idea of having kind of frontline workforce. I would say, like, actually, there's just a great article today in the New York Times about some of how the food banks have mobilized over the period of COVID. There actually was really kind of unbelievable workforce mobilization to keep a lot of these places going. It's true that some of the food pantries closed, but there was an infusion of dollars, let's say, into some of the larger food banks that allowed them to keep going in a pretty consistent way. So I would say a lot of the issue ended up being about coming up with creative solutions to avoid, to get, people doing drive-through or getting deliveries to people's doors. And some of the things that happened, like, for example, livery cab workers were tapped into to do some of those food deliveries. So actually there were some creative solutions to that workforce question. And so I think a lot of the issues around the exacerbated food insecurity was, in some ways because it was such a large problem. But I do think that the workforce of the emergency food networks were able to mobilize to some extent. We also saw the city do things like these massive efforts that hadn't been done before, like grab and go meals, where you could go to a school in your neighborhood and pick up a meal, which created some economies of scale that we might not have had before, where people could, tap into a larger effort. And so I do think maybe some of it was that at the beginning, but I do at the same time, I think there was, a real, infusion of support into some of those emergency food programs. One of the big things, though, at the beginning of the pandemic was about food getting to places. So because we rely on some, a lot of like large producers and kind of massive distribution chains here in New York, they were really upended by that beginning of the pandemic. And so there was a lot of issues of like food getting from here to there, especially at the beginning. You probably saw some of those even farms having to throw away milk and eggs and things like that.
Yeah.
A lot of that was the result of these massive infrastructure that we have. And so I think that might not have been exactly a workforce issue. It was more about the this fragile kind of food distribution infrastructure that did interrupt some of that food distribution at the beginning of the pandemic. But now there's been some real systems put in place that are, good. Still some questions about the healthfulness of the food that people are getting.
So I live next to an elementary school,
Yeah.
and even when the schools were closed, they were they were offering
Mhm.
meals to kids. But, this one, one of the guards who was there said that a lot of the kids, if they don't live in the area, they're not going to come. So that was a big problem.
Yeah.
So do you think opening up schools is going to be a very critical thing to getting kids more food because they do have the safety net in the schools?
Yes. I mean, I think there's a few things there that I think are really important to point out.
Mm.
I think that is an issue. The schools really, there was a big effort to get people meals at their school locations, even when the schools were closed. But right, a lot of people couldn't just, walk next door to get those meals. And, and I think sometimes there were some questions about the quality of the food at the beginning. There was a lot of focus on it. And so some improvements got made. And, so some people I think maybe felt like it wasn't, the trip wouldn't get them a set of nutritious foods that they needed anyway. There's been a huge effort to really improve upon that. The other thing that happened that's important, especially for New York City, around the school issue is in New York City, we have something called universal school lunch, which means that all New York City school children, regardless of income, are eligible for free school meals. And that's really it's an important policy that's put into place to reduce stigma around free meals. And what that really did during the pandemic that's important is there was a federal policy that got put into place called pandemic EBT, pandemic electronic benefit transfer, which essentially was a debit card with dollars on it for all families who were eligible for free lunch and it gave them in the previous school year about $420. And there's another allocation coming up in the spring of this year. And so in New York City, that meant every family got access to that EBT card or that debit card because we have universal school lunch. And in other parts of the state, many thousands of families also got that debit card. It was a critical piece. It didn't solve the problem, to your point. I mean, the real consistency of having kids in school is what's important for them. Many students, those 2 meals they're getting in school are their 2 meals of the day. And so it's critical. I do think the pandemic EBT program, which got that debit card into people's hands, in addition to that option of picking up meals, was really important. That debit card, yeah.
That was a federal program?
It's a federal program.
Okay.
And then it got administered at the state level. And so we're now awaiting that kind of second tranche of dollars to come to families for this current school year. It's obviously, that's $500-ish isn't going to, per child, isn't going to solve everything, but really important for people, allows them to use their dollars in their community nearby. And that's now been extended in the latest kind of stimulus. We have some extension on that program.
Okay. So the question is, has the corporate world increased its financial support of food banks in response to the COVID-19 crisis? And I guess I would also like to add to that question, who is stepping in? I know the federal government is supplying money, the states are, but are nonprofits stepping in or are they also, but I also know nonprofits are squeezed for dollars.
Right.
Yeah.
No, it's a good question. So I think I don't have like the exact kind of assessment of kind of what the corporate contributions have been, but I think a lot of corporations, food and hunger was already kind of a way that they were doing their giving. And so I do think there's been some step up at the corporate level and especially for some of these programs that you might have seen, like World Central Kitchen, some of the kind of banner type of programs where especially restaurateurs were mobilizing their restaurant workforce and their food to get meals out to families in need. And so I do think there's been some real interesting things like that in the restaurant and food world, which obviously is also struggling. I do think some corporations have stepped in, especially corporations that might have had some food related work already going on. The huge bolus of dollars is obviously coming from the federal level, in the billions and millions. So you had out of the various stimulus packages that played themselves out in lots of legislation, you saw things like many millions of dollar or billions of dollar allocation for things like healthy food, shelf stable meals, for food banks. So it was like across the board, food banks were getting access to dollars for emergency food to get to families. At the state level, you see, like, for example, some good examples in New York State that are pretty creative is there's this program called Nourish New York. It's a $25 million initiative that allowed food banks to purchase food directly from local farms. Win-win, gets the farmers purchases at a mass scale, and the food banks then can get that food out to communities and families. The state also launched an initiative in partnership with HelloFresh. Speaking of kind of more private sector, HelloFresh being one of those meal kit delivery programs. HelloFresh donated lots of those meal kits, partnered with the state and the city to get them out to veterans. That was actually a veteran-specific initiative. So things like that are happening. So there's definitely a step up on the part, I think, of some of the private sector. Philanthropy, where I sit, has been very attuned to this. A lot of philanthropic organizations that might have had a specific food area, like the New York State Health Foundation, obviously did a lot of giving in that space. And then I would say even in philanthropy, where it might not have been their core support or core program, did end up pivoting to do some food giving because of the crisis. And then I can talk a little bit about the community-based kind of nonprofit sector too, which
Okay.
is
So why don't you tell a little bit about the New York State Health Foundation, because I don't think people know much about it.
Sure. Yeah, happy to. So the New York State Health Foundation is a private independent foundation. Our mission is to improve the health of all New Yorkers, especially the most vulnerable. We operate grant making and programs in 4 areas. So we do work in the area of consumer empowerment, which is really focused on kind of patients having a voice in their healthcare, and also making sure that data about healthcare is transparent so people can use it to make good decisions. We have a whole area focused on veterans health, really making sure that veterans have access, in particular post 9/11 veterans, to both community-based healthcare supports, as well as access to things like peer support, suicide prevention, mental health services. And then we do a kind of responsive grant making arm, which has really allowed us to do a lot of support during the pandemic. We call that our Special Projects Fund, but it really allows us to do work in health, but health intersecting with a lot of other issues, whether it's criminal justice, mental health, public health issues, issues around childhood. And so the foundation really has a statewide view. So we do our programming across the regions of New York State. We partner with other foundations in New York City and across the state. And we also have at the moment, I would say we probably have close to 200 active grants with nonprofits spread across the state, especially in communities that have highest disparities in terms of race, ethnicity, or income. We really spend a lot of time, as I mentioned at the beginning, trying to make sure we can use what we're doing from a programmatic perspective and what we're hearing from communities on the ground to advocate for important policy changes and for expansion of good programs. So we see ourselves as a kind of change maker in that sense, really making sure.
Who is funding you?
We are endowed foundation, and we're what's called a conversion foundation. And so what that means, there's about 100 conversion foundations across the country, and they result often from a particular transaction that happened with, let's say, a health insurance company being sold, or health insurance company merging. And then what happens is those dollars, the profits from that transaction, in our case, a piece of legislation set out the parameters of the foundation when that transaction happened, and put into an endowment, and that's how we fund our work. So we're yeah.
So let's go back to the question.
Sure.
Will the federal government continue these subsidies for a period of time post-pandemic?
It's a good question. So, and it's definitely, I think, on everyone's mind. So the latest stimulus package had a lot of great stuff in it when it comes to food insecurity and food benefits. Some of them pushing out to September of September 2021, which I don't think will be the end of the pandemic. I think there will be a lot of advocacy at the state and federal level to keep some of these things going. So as an example, some good examples are the food stamp program or the Supplemental Nutrition Assistance Program, SNAP. In the latest round of the pandemic, the SNAP benefits were increased by 15%. That means something around like a $30 to $40, depending on the size of the family, more benefits in people's pockets per month. And that 15% bump was extended through September. And it will likely make a huge amount of difference for people. I mean, month over month. And I do think there will be a lot of advocacy to keep some of those types of expansions going. That's just one example. Another example is what I mentioned earlier. At the federal level, there's been an infusion of dollars for food banks to purchase emergency foods and then hand them in, and then distribute them to communities and other nonprofits who distribute them. And I do think that there'll be similarly a real a sense of advocacy to keep those going. We've also seen people start to say things like that school-age children program I mentioned. We should make that permanent. Like there's been a lot of advocacy around that. So I think towards the summer we'll start to see those conversations happening. Like what's after September.
Now, we've also always been told that Europe, they have centralized system.
Yep.
But they're much better at. They have bigger safety nets than we do. They have guaranteed income. We found out they're not so good at distributing vaccines because hardly anyone in Europe is vaccinated. Right. I mean, in some countries, only people 70 and above, and
right.
In Germany recently was 80. Only you had to be 80 and above. So they're not doing such a good. But how are they doing in terms of food scarcity?
It's a good question. I feel like I can't speak to the exact rates, and I definitely want to do a little bit of digging on that after.
Okay.
I do think but you make a really good point. I think that the both the centralized health system, but also their investment in social services. We know, in particular, even their rates of diet-related illnesses, diabetes, hypertension, are lower across the board than in the United States. So I do think there's also that kind of confluence that there's, I think less of, and those diet-related diseases being more risk factors for COVID. So I imagine that because of those stronger safety nets, both in terms of the income and their just investment generally in social services, that the rates would be lower. But that's something that I would love to follow up on and share with the group after.
Okay. It seems that support has been coming from many different sources, as you said. Going forward, will there be changes in infrastructure to help provide coordination?
Good question. So a lot of people have been talking about that. I think, one of the things that I think many people in this sector, both I would say in the kind of healthy food access sector and then the more kind of food production sector, agree that kind of we have to build back a better food system. We especially around equity, we already knew before the pandemic, there was already a lack of access to healthy and affordable foods in low income communities and communities of color. And it's just really, the pandemic has shown such a light on that as an issue. And so a lot of people are now talking about how can we build the food system back better? While there was a Herculean, as I said, response to kind of from an emergency perspective, a lot of people are talking about now what are ways to do that. So one good example in New York, an example is that what we did see is this kind of reliance on large food producers did create some real interruptions in getting food to people in the crisis moments. And so people are talking a lot now from a coordination perspective. how do we get some of those local producers, local farmers, smaller farms, who did end up stepping up and getting food to their local communities? How do we get them more into the larger food system? So how do we help them be part of larger procurement systems and get the larger systems purchasing foods from them? And so I would say the city and the state are thinking a lot about that. New York City has just launched, it's interesting document to take a look at, their 10-year food plan that the city council actually it's by city council law pre-pandemic, but it happened to just come out in the context of the pandemic. And so the city is looking at a 10-year food plan on how to coordinate amongst all these partners. The state, through the their Department of Health and also Agriculture and Markets, has a whole set of working groups that are coming together to try to answer some of these questions. And so I do think there's, a growing effort and kind of investment, both from a funding perspective and just people's human capital, to be coordinated and to think about ways that we can come out of this with stronger systems that will be, more in the face of another crisis. They'll be better set up to respond and hopefully keep people in a healthier space, when hopefully there will not be a pandemic in, a year from now, let's say.
I think one thing I saw that, caused the pandemic is that how fragile our economy really is. With,
Exactly.
When restaurants close, when people who have, are yoga teachers or massage places, legitimate places,
Yep.
Theater and all these things, that there was not a lot of safety net.
Right.
And people are, very, like say one check away from being homeless and not being able to eat.
Right.
So what are some of the lessons that we've learned, from this pandemic that we can, so when it ends, what can we say to go forward to not only, deal with the fragility but also the healthcare equities, disparities between Hispanics and Black Americans. I know it's not going to be an easy solution, but what are some of the things that you guys are thinking of long term? Yeah,
and it's a great question. I think, and it kind of goes to one of the things we thinking about a lot is like, we're going to be, it's not that the pandemic is going to end and then food insecurity will be back to these rates that we were seeing before. One important thing to note is when the pandemic hit around the 2019 rates, national rates of food insecurity, were actually like potentially almost the lowest they'd been in many, many years. It wasn't that there was like a precipitous decline over the years previous to 2019, but we were at a place where we saw that food insecurity isn't necessarily intractable. There were solutions that might have been starting to work. It was at we were at the lowest rates. And then the pandemic upended all of that. And then, we also have our lessons learned from the Great Recession in 2008, where it really took close to 10 years for some of the food insecurity rates to recover from that. And so I think we're in it for the long haul here in terms of recovery. I mean, I'm not a expert in terms of kind of the recessionary effects, but I do think we probably have we really do need to be looking towards long-term solutions. I would say one of the biggest things that we've seen and that we're thinking about is that overnight, some of these food benefits. So when we talk about food benefits, we're saying like food stamp SNAP, the Supplemental Nutrition Assistance Program, WIC, which is the program for women and children that also gets them healthy foods and breastfeeding support and formula in some cases. And some of these nutrition incentives that I mentioned that allow people to kind of maximize their dollar in terms of food benefits. We saw overnight barriers just come down in some of those programs. So whether that was extending periods when people had to re-enroll, so extending, saying, okay, you're eligible for this much longer, you don't have to re-enroll, coming up with ways for people to enroll online or over the phone when they maybe would have had to do an in-person visit otherwise, increasing the benefit amounts, here in New York, we're one of several states that has implemented a way for you to use your food stamps dollars to shop online. And so some of these barriers were things that we had erected in order, maybe they were put into place for fidelity of these programs, but we're seeing that it works to break down some of these barriers. And the food stamps program, for example, is, the largest federal food benefit program. It provides a really sustainable set of dollars for people to access healthy foods. It brings dollars into the local economy, and we can be more flexible. And so I think a lot of people are saying, let's look at what we learned from those kind of flexibilities and increases in benefits, and let's try to make some of those permanent, because it is, more of a sustainable solution than obviously emergency food is critical and needed, and our food banks were, stepping up like never before. But those sustainable solutions are what we need, and so that's for sure one. And similarly, kind of building on that, is we have all of these benefit programs like food stamps and WIC, and even some of the other, health insurance programs. And they all have different ways of enrolling. So a different system, a different agency you need to go to, or school food. But oftentimes there's, the eligibility criteria are quite similar and overlapping. And so there's probably a lot we can do in terms of really making sure there's, one door for people to get into a lot of these benefits, assessing, cross benefit eligibility and getting people enrolled. Those are steps that, it obviously takes some work, but I think we showed during the pandemic that a lot of those barriers that we thought, couldn't come down in terms of enrollment or increased benefits did. And so that's for sure something we want to be supporting as we move forward.
Okay, so now we have a 4-part question.
Okay.
Okay. Does the federal government pay farmers not to grow food? I mean, I know I've heard they have in the past, but
Wait, can you repeat what you
does the federal, you can see them in the Q&A also. Does the federal government
yeah.
Does the federal government pay farmers not to grow food? That was in the past, I think.
Yeah, I mean, you're probably referring to some, there are some, so one of the other key things, I am less as familiar with all the kind of intricacies of the Farm Bill, but one of the other things that's coming up, and it will be something we should all be keeping our eyes on, is there's both the Farm Bill, which, I think has dictated some of these issues around kind of the relationship between farms and the federal government, obviously, and the Child Nutrition Reauthorization Act. Both of those federal pieces of legislation dictate a lot of what happens in both the food stamps program and the WIC program and the school meals program. And they're all going to be in the mix of discussion at the federal level over the next kind of 1 to 3 years. And so very much we should be keeping our eye on those too, because they might be places that we can be looking to kind of codify some of these flexibilities that went into place over the pandemic.
So some of these, so here's a question. What impact did the pandemic have on farmers growing food? Did growing food slow down?
There was some slowdown. I have less of the facts about kind of how it picked back up. The issue was around, and that's what you saw at the beginning in terms of what we were seeing as
logistic problems, sure.
Exactly, because like the way that they would typically package their food was made for like large production, like sending it to a school or sending it to a large institution, and so they weren't ready to like repackage a particular product for consumption either at the individual family level or even to be distributed at a food pantry. And so that did affect a lot of the farmers. And that's why New York State in particular stepped in with that Nourish New York initiative to try to heal some of that infusion of the $25 million so that some of those food banks could be purchasing the food directly from farmers so that they could keep up production. But there, still a lot of interruptions there, but some creative solutions to try to avoid some of that food waste.
Okay, so basic question: why do people in this country go to bed hungry? Even before the pandemic, and that I think some of it is that there are a lot of inequities, and so different states have, some states are more generous in food stamps than others. And it's just, there's a lot of inequities in our systems.
No, and I think a lot of us, right, we would agree that like having access to healthy food and not being hungry should be, the right of all people living in this country. And right, it's, I think it's potentially, a downstream effect of some of the larger issues we have around poverty, obviously, and how poverty affects different communities, and that, the inequities. I think, kind of at a New York and neighborhood level, when you talk about those disparities in terms of access to food, one of the things we really need to try to solve for is generally this idea of people going to bed hungry, but then also how access looks different in different communities. Some communities just have more access to healthy foods that are affordable. In low-income communities, we don't see that same access before the pandemic, and now during the pandemic, it's it's continuing to play out. And so I think that's a lot of the energy we want to invest over the coming period, is to figure out ways to, like, even at those neighborhood levels, to come up with scalable solutions. So there's access, and that our public institutions like schools and hospitals and senior centers also have access to those healthy foods, so that, people can tap into those safety nets.
All right, so there's one more question I want to get to.
Sure.
Could this remediation be reframed into a conversation about disease prevention, especially in terms of child health?
Absolutely. I think, we didn't talk as much. We focused, I just touched on that at the beginning. And we talked a lot about, the food scarcity rates in particular. But I think actually, of course, coming from the Health Foundation perspective, I would say that's front and center. The connection between food and health is so real, and intertwined. You can see, food often acts as medicine. But there's also diet-related diseases. And so you see people, kind of that cycle of people without access to healthy foods are often the same people who have higher levels of diabetes, of hypertension, of obesity. And they also, need those healthy foods to thrive and often to heal from illnesses. And so one of the things that's happening a lot, which is another kind of layer, is this idea of connecting food as medicine. So connecting the healthcare system and the food systems. And so there are also some really interesting things happening in that space. Hospitals giving prescriptions for healthy foods. And, really to the point of the question, this idea of the childhood being that intervention point that's super critical. And that's why those rates that we're seeing of childhood food insecurity are so troubling, because, a lot of that early childhood issues around health kind of, there's effects, especially for adolescents, around, healthy food access. And so we could definitely, I think there's for sure, that's, how a lot of how the lens that we see these food issues through is really that connection to health.
Well, I remember years ago, the editor of Men's Health wrote in the New York Times and said he grew up very poor, and he said they didn't have a Whole Foods in the areas where he lived. They didn't have vegan restaurants. They didn't have vegetarian restaurants. They didn't have health food restaurants. He said actually the food was more expensive in the small bodegas than it was in the large grocery stores. And
you hit on the exact point.
Yeah. So that is a question. So I was
so lower quality and higher prices. Yep.
Yeah. So before I end, I just want to say we're taking a break next week. So April 14th, we're going to speak to Helen Fisher about dating in the pandemic, part 2, because she spoke with us last year. And then on April 22nd, I believe, we're going to discuss a book by Liz Henneke, who is called Radiant. The book is The Dancer, the Scientist, and a Friendship Forged in Light. It's about Marie Curie, the only woman to win the Nobel Prize, or actually the only person to win the Nobel Prize twice, and her relationship with a dancer, her friendship. So anyway, I want to thank Avital for spending an hour with us.
Yeah.
And good luck in getting your vaccine.
Thank
Go
you.
go on the sites. Yeah,
Yeah.
I learned I had to be persistent. Even when I was persistent, I had my
Okay.
vaccines canceled twice, but finally I got them.
I'll keep refreshing.
Anyway, so thanks. And how do people, if they want to donate or do what can they do?
Well, happy to, as a foundation, no donations needed, but happy to, I can put, I think if I put my email in the chat, I'm happy to do that. Or you can find me if you go to New York State Health Foundation. I'm in the team list there. Happy to, talk to folks about any questions they had, both about kind of what I spoke about, or if you'd like to, get connected to any community organizations doing this work. We obviously have a whole range of partnerships, so would be happy to have that conversation and make those connections.
All right, so we'll post your email to the website because once it ends, the chat disappears, as you know.
Yeah, exactly. Right. So
anyway, thank you for spending an hour with us. Stay safe, everyone, and we'll see you in 2 weeks and talk about dating and the pandemic.
Thanks for having me.
Okay, take care. Good night.
Bye-bye.